Well, what we've determined with your knee is that your knee specifically has worn out only on the inside. That's on the medial side of your knee, as we call it. And what has happened is you've lost your cartilage, you've worn that away, and now the bones are rubbing together there. But we have determined by looking at your x-rays before surgery that you do not have that same cartilage wear problem on the outside of your knee or in the kneecap area. So for that reason, we feel that your knee could be a good knee to consider doing a partial knee replacement, which is 1/3 less surgery on the knee than doing a full knee replacement. But as we talked about in the office, we need to have a backup plan in case when we look at the lateral outside part of your knee, if that cartilage doesn't look good, then we will go ahead and proceed with a total knee replacement. But that only happens less than 5% of the time. When a partial knee replacement is performed, that inside part of your knee, what we call the medial part of your knee, the thigh bone is basically, that bone is contoured to resurface the end of that bad bone and cartilage with a metal circular piece. And then the top of the shin bone is shaped to allow for a new metal tray that supports a plastic bushing that you then walk on between those parts. The long-term recovery and outlook for a partial knee replacement should be similar to how long a total knee would last. So what the best information that we can give you is that when we look at hundreds of thousands of patients that have had partial knee replacements or total knee replacements, approximately 15 years later, 80% of them will still be functioning well and be doing well.